My name is Mcebisi Sidlai. I am a South African filmmaker and a communicator. I am currently working at Media 24 in the television division as an assistant media manager. So today I am here to give an overview of a project that I was part of, which was very close to my heart because it has changed my life in a way that I felt such project needed to go on so that it could change other young people's lives. So the project was conducted by Dr. Warren Hickson. It's called the SALUS Project, and it was a HIV communication intervention. When I was born, it was 2 years before South Africa received its democracy. And it was 11 years since the first case of HIV infection was reported. And it was 8 years since the first person died because of AIDS. Now today we are all gathered here to look at possible solutions to issues that affect our communities and human development in turbulent times. My presentation will focus on both youth infected and affected by HIV and AIDS in South Africa, and how digital storytelling can help increase HIV and AIDS knowledge while addressing their vulnerability and enabling their central capabilities. So before I go on, I would like to play a film that I made for the SALUS project. It's very not long, it's 3 minutes, but I think it will give context of what I will be talking about going forward.
HIV is the killer virus, or so they say. But is that really true? I'm not really sure how people came to this conclusion, but according to our research, I have found that the lack of knowledge is the real killer here. My people are so afraid of HIV it hurts. At times it makes me cry. They believe that HIV is this unstoppable virus that's out to kill, and that no one can do a thing about it. Well, that's a lie. So, as part of the SALUS project, I decided to find out why my people see HIV as the killer virus in our country. My research gave me answers. HIV has indeed caused many deaths in the past. I then asked myself whether those people knew enough about HIV and how they can live with it, that they didn't have to die because of it. Did they understand what undetectable viral load means, for example? No, my people didn't know. That is what killed my people back in the days, and it is still the same today. It's a lack of knowledge that kills. It's the lack of knowledge that kills my people. It is no different now. People fear the disease, and then they fear one another, which is the root of the stigma that causes the killer silence. My people are still paying the price, and because of fear, many kill themselves. Suicide one after another. We keep losing our young brothers and sisters each and every day, simply because they had little information about how they could manage their positive status. They are literally scared to death. This would change if my people had better knowledge. It is high time that we as young people fight against the real killer here. Together we can kill the lack of knowledge. Let's come together as community and stop this disease through knowledge. We can change this by sharing knowledge together through becoming the communicators in our communities.
So this is the very first film I've ever made, and this was part of the SALUS project. And so why this, the capabilities approach was so interesting to me was that this was the first film I made, and before this, I didn't believe that I could make anything. I didn't believe that I could make a film. But with the help of this project, which used capabilities approach, it activated my capabilities, and so I made something this meaningful. And after this, I never stopped. I went on and on and on. And so I started making films that we went around in clinics and started using them to engage youth to be part of the Salus project and share knowledge. And so it is also because of this film that today I'm here. And so it means my capabilities haven't stopped, I'm still going. I'm going to give a bit of history on digital storytelling and why I think it was relevant back in the days and still relevant today. For at least 40,000 years back, dating to the earliest known cave paintings, visual stories have been part of people's lives. Oral stories were told long before then, passed from generation to generation, connecting people, shaping their worlds, shaping their lives, and changing history. Storytelling is both science and an art because they allow us to experience information as opposed to just consuming it. For example, when you are watching or listening to someone telling their story deeply, it makes you feel like you are in their position. It enables your imagination and feelings. That is why sometimes other people cry when they are watching or listening to an emotional story. Stories help us see cause and effect relationship beyond facts and data by triggering major areas of the human brain that shape our thinking and ignite our emotions. In today's digital world, stories can be created and shared like never before. Just over half of the world's 7.7 billion people can now create, consume, and share digital content socially. Increasingly, social media platforms are where people turn for discovery, information, and entertainment. About 970 million people used social media in 2010, compared to 4.89 billion users in 2023. And this is projected to increase to 7 billion users by 2027. In this world of information overload and shrinking attention spans, meaningful and educational stories are more important than ever because they can simplify information in ways that other forms of communication cannot. To be diagnosed with HIV and AIDS is shocking, and that shock is inspired by tragic historical events at the height of the epidemic between 2000 and 2007, in which people who were diagnosed became gravely ill and sadly died without much available treatment. In South Africa, many people died of the disease because of a lack of knowledge and accessible treatment. Because of that history, though, South African youth who are living with HIV today are vulnerable. Many have lost hope and a sense of belonging, and they live in fear that they too will die of the virus. In addition, they are afraid of the long-term stigma and discrimination associated with the virus in our communities. As a result of HIV lack of knowledge, the number of young people testing HIV positive today is still increasing, and some are defaulting, others even die. And according to UNAIDS, low HIV and sexual health knowledge is the key barrier to reducing HIV infections among youth. Within South Africa, only 43% of young people are reported to have sufficient knowledge about HIV prevention. Now, because of persistent lack of knowledge in our society, misinformation and confusing HIV communication, we have an ongoing communal fear and vulnerability that makes young people susceptible to contracting the virus and holds them back from reaching their full potential and capabilities as they grow through life with an HIV-positive status. Young people are vulnerable to HIV because of substance use that leads to risky sexual behaviors and lack of access to HIV information and prevention services. HIV and AIDS is one of the main challenges facing a post-apartheid South Africa, with more than 8.5 million citizens infected with HIV. South Africa has one of the highest numbers of infected adults and young people in the world. The epidemic is generalized across the country's population and primarily driven by sexual transmission. In the first decade of democracy in South Africa, adult HIV prevalence rose from less than 3% to an estimated 18.1%. Late 2007, a UN report showed that More than 3/4 of AIDS-related deaths occurred in sub-Saharan Africa, and South Africa was officially the country with the highest prevalence of HIV in the world. A UN 2008 global report on the HIV and AIDS epidemic showed that around 5.7 million South Africans were estimated as having HIV, including 300,000 children under the age of 15 years, while 350,000 died from AIDS in South Africa in 2007. Now, one of the most significant indirect damages caused by the disease was the number of children orphaned as a result of AIDS. If orphans are defined as children from birth to the age of 17 whose parents have died, UNAIDS estimated that there were 1,400,000 children orphaned due to AIDS living in South Africa. These young people grow up with trauma, of course, and no life guidance, and this has a negative impact on the development and freedom of these young people. It forces them into precarious circumstances, exposing them to exploitation and abuse. Many children are struggling to survive on their own in child-headed households, as it sometimes happens after the death of a parent. Others are forced to fend for themselves and for their siblings on the streets. Consequently, there is an increasing number of unprotected, poorly socialized, and undereducated young people in South Africa. Research shows that children whose parents have died are less likely to attend school and those who have not lost a parent. Now, youth living with HIV and AIDS are more likely to experience emotional, behavioral, and cognitive difficulties due to both direct and neuropsychiatric effects of the HIV and AIDS infection on the brain functioning and the indirect effects related to a wide range of stressors, including the complexities of adolescence and experienced stigma that compound living HIV and AIDS. Research shows that HIV and AIDS has a strong negative impact on individuals' social integration, as their status often evokes stigmatization and discrimination in their community, leading to poor social support. Now, youth living with HIV and AIDS are also prone to experiencing difficulties with independent functioning, school participation, and educational performances. Experienced challenges and supportive measures mostly come into effect in natural living environments. Since youth spend most of their time within schools, the school's community is an important natural environment for cognitive, personality, behavioral, social, emotional, and physical development. For youth living with HIV and AIDS, the school conditions may either facilitate or hinder their quality of life, among other things, through affecting their self-care behavior and adherence to art and other interventions. Since the beginning of the HIV epidemic in South Africa, lack of knowledge, lack of access to treatment, and stigma have always been a major problem. These issues have been a problem because HIV and AIDS came as a shock for everyone in society, including our government, our health institutions. For some time, we could not figure out how to effectively prevent and treat this disease. Hence, many infections and deaths in the past. Now, finally, during the rollout of ARVs in the early 2000s, we had hope that ARVs were going to reduce HIV-related deaths and decrease HIV infections. But what about increasing HIV knowledge? Surprisingly, infections are still increasing every day, especially amongst young people. According to ENCA News, reporting on Statistics SA, recently reported that in KwaZulu-Natal, South Africa, 1,300 young people between the ages of 15 to 24 test HIV positive weekly. This raises concerns of whether our focus and efforts are in the right place as we try to fight the HIV virus. It seems to me that we are still using old methods, focusing on prevention, and when I say prevention, I'm referring to focusing on treatment and access to it, but not increasing HIV knowledge. Prevention and access to care don't mean much without enough knowledge. Our efforts are not progressive in this way. These are short-term solutions for me, and these strategies do not address the real problem. Hence, HIV infection continues increasing among youth. We need to pay attention to increasing knowledge rather than just increasing or coming up with interventions of treatment. Now the question is, what does our future look like pertaining to this epidemic? What kind of communities are we going to have? We need to urgently engage young people and put creative measures in place to educate and increase HIV knowledge in order to stop the increasing number of infections among youth today and enable central capabilities of those living with HIV. We need to engage how we educate. We need to put effort into our health communications, use exciting, relevant, and creative ways to better how we engage, how we educate, and how we share information. Most importantly, we need to involve young people in creative ideas for community development, especially as it pertains to health issues, because young people are the drivers of change. So what does digital storytelling refers to? Digital storytelling refers to any story that is told using digital technology, including video, audio, and photography, to reflect the realities of those people represented or to communicate certain issues. Over the past few years, this emerging participatory media production method has been taken up in many community, health, educational, and academic settings, drawing from well-established traditions in popular education, participatory communication, and oral history. Practitioners of digital storytelling, like myself and others around the world, are working with local level and multinational organizations to facilitate the production of short and long-form digital videos that document a wide range of culturally and historically embedded lived experiences. At the level of community-based health practice, storytelling is increasingly viewed as an effective tool for motivating and supporting health behavior change. When audience members become immersed in a story, they are less likely to counter-argue against its key messages. And when they connect to the characters in the story, those characters may have greater influence on the audience members' attitudes and beliefs. The Salus Project initiative builded upon this perspective in its work to support the telling and witnessing of the stories that too often remain unspoken. The initiative was grounded on the notion that personal stories can inspire, educate, and move people deeply, and that when it comes to confronting complex social issues, the connections forged through storytelling can help people bridge the vast differences that often divide them and instead act with wisdom, compassion, and conscience. The Salus Project was a HIV research initiative that was led by Dr. Warren Hickson in the township communities of Gugulethu and Khayelitsha in the Western Cape province of South Africa, and later piloted in Eastern Cape. It was led by Apiwe Mtendeni, who was 28 years and was the leader of the project. And myself, I was leading the creative direction of the digital content, while Zikona Dingile, who was 26, was running our social media platforms and youth engagement. And then Cindy Mkuye, who was also 26, and Kolam Teto, 24, and Tembisa were researchers on the field. As a team, we were all creatives and filmmakers from the communities in which the project worked in. Using the principles of human-centered design, we co-developed a communication platform designed to engage young people about HIV treatment. The tool included a series of animations that carefully explained HIV disease, how the treatment works, and the science of undetectable viral load. Storytelling films of hope from other young people who are living with HIV were also incorporated. The communication tool was used as a part of a new communication approach designed to change HIV testing and support young people's first phase of adherence. The strategy and tool were tested during a pilot study conducted in 2 clinics in the townships, Gugulethu and Khayelitsha, as mentioned. One of the key outcomes from the pilot was that medical concepts are best understood when they are presented in an interactive multimedia format, allowing time for learning. Findings also indicated that multimedia communication approach was effective in supporting young people's learning about HIV and treatment. increasing their hope that they can live a normal life post-diagnosis. These factors contributed to their motivation to adhere to ARVs and remain in care during the period of study. In the first phase of the study, we had a group of young people who lived in Gugulethu who were born HIV positive. One of our creative activities included a focus group that was shared in the form of an audio podcast, because some of the young people said they wish people could hear what they had to say without having to show their faces, as they fear being stigmatized. Most of the young people spoke deeply about what motivates them to take their treatment, while others shared why they are not motivated to take treatment, how the virus affected their daily lives, including their relationships, and how fear of stigma prevents them from living their lives freely and fully like other young people. They also spoke about the pain of watching their parents getting sick and dying of AIDS-related illnesses. And they also spoke about how badly they are treated and discriminated against at the community clinics. Other comments included having sex with their partners without using protection, because their partners did not want to use protection, and they couldn't tell them their status because they feared losing them. They also feared that if they tell them about their status, their partner might break up with them and ended up telling the whole world about their status. One of the comments from the podcast was that a young person said, "What motivates me to take my pill is because I don't want to end up like my father. My father died because he was in denial until he died. He died a slow, painful, and unbearable death." One of the learners said, the Salus project came and educated me that people who are living with HIV are the same as us. All they need to do is to take their medication very well, like they are told at the clinic. And one of the teachers said, the workshops were very effective. We as teachers, we need to be taught more about HIV because we also lack knowledge when it comes to HIV. And we are parents to the learners. So we need to make sure that the information that we share with them is correct. And the Minister of Education said, the work that you have done here over the past 7 weeks is enormous. Even the Department of Health is saying that the number of young people testing for HIV has increased now. The project proved that the science and human benefits in digital storytelling in both making and watching of films is crucial. And so if we could adapt it in our initiative, that would bring so much change into the world and to the young people.